Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by my very pedantic co-host. If you know, you know, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. The last time we used the word pedantic on this podcast, we were talking about Reddit.
Right.
And that's what we're talking about today.
Not weird Reddit. Plastic surgery Reddit.
Pedantic. Yes.
Loquacious.
Oh, I wouldn't say loquacious either. That's getting kind of weird on Reddit.
Okay, that's a good point.
But if you are interested in watching this podcast, if you somehow are only listening, you can find us on YouTube at Jason Martin MD and at Beauty and the Surgeon podcast. Everywhere you want to find social media, we are here. You can also send me a text or leave me a voicemail at 303-630-9038. So if you didn't watch our first episode where we talked about Reddit, we were talking about things I wish I knew before a tummy tuck. Mm-hmm. And it was really fun. So occasionally now I do look at things on Reddit, and this one question came up, and it is this one, and this is what will start off the episode. Has plastic surgery improved your self-esteem? I believe people are more than looks. However, sometimes a little push goes a long way. Do you feel your surgery helped you improve your self-esteem? And I was like, wow, like that was a great question. And you know, I think we both have our own thoughts on this, Dr. Martin. And we've talked, it was several years ago, we did an episode, Will Plastic Surgery Make Me Happy?
Right.
Where we looked at the actual scientific data on whether or not plastic surgery improved happiness. But this was specifically asking about self-esteem and was not tied to a specific surgery.
Yeah. So happiness, we showed, at least from that discussion, that no, it does not increase happiness.
Or it does. It either does, it doesn't, or it might.
Yeah, right. It depends on what we were looking at. But self-esteem is different than happiness.
Yes,
and
very
self-perception
different.
is different than happiness. You can have good self-perception and not be happy. I mean, so they're not 100% correlated. Obviously.
Oh yeah, they're not. I would say they're not.
Right.
Yeah, they can be drastically different.
If you have improved self-esteem, improved self-perception, you're probably going to end up being more happy, but it doesn't mean it correlates.
No, I mean, I would say some people who have the highest self-esteem might have some of the lowest rates of happiness.
That's
like
deep.
Narcissistic, like very self-centered people. Are they happy? No.
I'd never even thought about that. Do true narcissists have happiness?
Right. We talk
right? Because like they're so disordered in terms of how their brain works.
Only if they're feeding off of others.
Exactly. Yes. That's true though.
Wow.
Yeah.
All right.
So I'm obviously not going to read all of them, but I have a bunch, and they run the gamut, and then I have a couple of other really cool ones later on. So
are you going to read it and then we talk about it, or are you going to read every single one of them? What are we doing here?
Yeah, I mean, we'll talk about the ones we want to, and we'll just go over the rest. Yeah, this one, 100%, but it's a slippery slope. Once you realize how great you feel with such an easy fix, which I would disagree with the easy part, but for some things it is, you start to think about what else you can fix and thinking about what else might be wrong. Unfortunately, it isn't too great on the self-esteem, right? Interesting. So they said it improved their self-esteem, but at the same vein, it also isn't great for your self-esteem because you start nitpicking yourself.
So there's a little bit of an empowerment part of it when you do something to make yourself, quote unquote, better, and you do it and you see the results of it. So that's the one thing about plastic surgery. You can actually see the effect of it. Like if you get your ACL fixed or you get something taken out in your belly, you can't really see it, but you can actually see this. Then that is empowering and you feel, wow, that was great. Then there is that next, well, what's next? That's human nature.
I call it the stars in the sky.
And we see that all the time, especially at our office, because we like to wrap around our patients. We like to make them feel welcome, feel like they're part of our family. So they're kind of emboldened, they're empowered, they're pumped up, they're excited. And they're like, what's next? And that's where I think your self-esteem can, or I don't know, maybe it's not self-esteem, but you can take a little bit of a hit there because you start realizing that this is somewhat of a domino effect, or can be.
Yeah. This next one, I got breast implants and my self-esteem skyrocketed. I was a pear-shaped before. Now I look like an unreal hourglass. Excuse my lack of humility.
Yeah. I
love it. This one is really good. They said yes, because as effed up as it sounds, if other people treat you better, you'll feel better about yourself. And this is where it's tough because yes, in some cases, people feed off that positive reinforcement. But what if you don't get it and you expect it?
So this brings up something that we do. So we'll do a facelift on someone, a woman, mid-50s, who's a professional, very successful. And there's, definitely differences in gender in the workplace where women,
gender bias is real.
where women are expected to look better as they age over men. And then also if they're in a position of leadership, they're judged differently than their male counterparts. So we're doing facelifts in some ways to readjust that so they can maintain what they have and actually keep succeeding or get better.
Well, or to continue to be seen as relevant.
Are we reinforcing really bad behavior to begin with?
Unfortunately,
which is really
we
what
are.
this question brings up.
Yeah. And that's very real. This next one is also talking about breast augmentation and rhinoplasty, which are two of the kind of tough ones. After my breast aug, rhinoplasty, and filler, I feel unstoppable. Yes. However, I do have the urge to constantly obsess and fix something else despite being happy with my surgeries. Right? So it can start
kind of what we talked about.
It's the stars in the sky. That's a double-edged sword. This one was simple. I had a rhinoplasty and no longer get comments that I have a big nose. It changed my life and self-esteem. What we say on the episode about happiness. Yes, because sometimes you fix something small and you just don't think about it anymore.
Right?
Yeah.
I always bring up the example of the lady that came in that needed a face and neck lift 100%, like the best candidate for it. And she chose to take off a mole and she was super happy with it. So it's all in the eyes of the beholder.
Right. And it's the thing that bothers you in that case.
Right.
Yeah. This next one says it helped my self-esteem, but as mentioned, it is a slippery slope. I also know others who felt insecure after getting plastic surgery. I feel like the best way to look at it is this. Being overall insecure, surgery will not fix this.
Right.
Having normal self-esteem, but having a few specific insecurities about appearance, surgery will help this.
Yep.
For example, if you hate your body overall, I don't think lipo will do a lot for your self-esteem.
Right.
100% correct.
And you could be normal secure. This is take a post-pregnancy woman, normal secure, like they're a normally secure person. They have a reasonable self-perception of themselves, but their belly is all messed up and it's not normal. Normal is not the right word. It's not what you would expect for a person of their age group, and pregnancy just basically destroyed it. So in that situation, it can be really burdensome to the person who has a reasonable self-esteem, and you could take that away and it makes them feel a lot better, both physically, in intimacy, in self-perception, in everything. So in that situation, for sure. But if they were a person that came in that hated every part of their body, that were very negative about their overall appearance physically, maybe they had mental illness, plastic surgery is just not going to work for that person. It just will not work. And we've had patients like that who, kind of hide it well, because I try to red flag that and then tell them no, or say, hey, this work on yourself first. And you can look at the results and they'll even say to you, yeah, I know these results are good, but I'm still not where I need to be mentally.
Yep.
And that's a lot of that is internal work.
There's actually a comment that almost parrots that exact same thing. The remainder of this comment said, but let's say you like your body, but it's just the love handles that you cannot get rid of, throwing off the proportion of your body. Lipo will help this a lot.
Yeah, that's exactly what I was talking about. Yeah.
So yes, like if you have a small problem.
Or if you have a big problem.
Right.
Yeah.
I mean, whatever the problem may be, if you're overall happy with yourself, you're going to be happy with yourself after.
Right.
Yeah. This person said, no, I got a rhinoplasty for subtle changes and came out looking different than I expected. And now I miss my old nose and I feel ashamed that I changed my face when I was already beautiful.
Mm-hmm. That's a tough one.
Yes.
That's hard to hear.
We talk about this on our episode about rhinoplasty because it, more than any other surgery, does have the potential to really change how you look.
Right.
And this person didn't realize their own beauty.
I know.
Right?
And
How
rhinoplasty
crushing.
is so specific. And I mean, I love this surgery. We have so many great episodes on it. I love doing it. It has amazing results, but it has to be very subtle.
Mm-hmm.
You have to use your words and communicate with the patient to tell them exactly what your vision is. And sometimes it's hard to think about how something three-dimensional would look with the change. Whereas like your belly, if the stuff hangs over and it's flat afterwards, you get that.
Yeah.
But the way a tip would look more refined, or the way a bump looks just a little bit down, is really hard for people to imagine. Most people are not three-dimensionally able to imagine things. They're
Well,
more
and it's also
two-dimensional.
Always right in front of them.
Mm-hmm. Every now and then, though, I get a patient in for rhinoplasty that's like 100% three-dimensional, and they start like blowing my mind. They're like, yeah, it's just bring this in, and like, it's like the Matrix when they're talking about stuff. But most people are two-dimensional.
Mm-hmm.
They think about themselves as a flat picture, less about things in a three-dimensional fashion.
Yeah, that's so true. These next two are both about being really positive. This one said, breast dog seriously changed my entire brain chemistry. Tons of exclamation points. A part of my negative brain has been completely quiet since surgery. I used to think I had to maintain an insane thinness for my frame just to match my boobs. Now my boobs match my natural frame and I feel like I look perfect and can finally relax on dieting and caring about my weight. Life-changing stuff. That's pretty remarkable.
Yeah. Isn't that funny about breast augmentation is such a double-edged sword.
Yes.
It's so instantaneous. And if you do it right, the patients are just like this. Exactly what she said. They're like, it's amazing. Like the clothes fit better. I'm proportional. I feel sexy. Blah, blah, blah.
I stopped over dieting.
Yeah, stop over dieting, all that kind of stuff. But then like there's this other part of breast dog where you get out of that balance area. And we have great episodes in breast dog. I don't want to do too many nils, but just pick one. Where we talk about that, if you don't get into that body balance thing with breast augmentation,
I think myths, link myths, plastic or breast augmentation myths.
Yeah, breast augmentation myths. If you don't get into that kind of balanced approach to breast augmentation, some people would call it natural, but I think that's doesn't really represent it. Something that's more body balancing. That's when you can get into problems, and then you trade one issue for the other, right? That you feel too heavy. It doesn't really balance your body out. But that's what she said. It's a perfect balancing for her body. And that's where breast dog is the best.
Right. Well, you juxtapose that with the very next one. It improved greatly after I got my breast reduction.
Yeah, reduction. Yeah.
People actually started looking at my face instead of staring at my chest. I felt human instead of being just a pair of boobs for men to drool over.
Right.
But you take the person before, what did they want?
Boobs.
Perhaps a pair of boobs for men to drool over, where if that's been your entire life. So
no, you don't want it.
That's
Grass is always greener.
But it doesn't matter. And that's the great thing about changing your body.
Yeah. Large breasts, I don't know. I wouldn't want those.
But
just
some
see
people
what people
do.
I know.
Yeah.
Hey,
and large is different to everybody.
Right.
Yeah.
I see people struggle for that, and you feel for them.
Yes. I love those two comments back to back because make it bigger, love it. Make it smaller, love it.
Yeah.
It's crazy how much of self-perception of beauty sounds like it's a lot to do with proportion and balance.
Well, look at art.
Like, right? It's exactly like, it's like to really feel good about yourself. It doesn't mean something necessarily needs to be super different. It's just when things kind of gel, like your body feels like it's in balance like that. That's when they're like, okay, now I feel good about myself. That's great.
I was reading a book and they brought up the antiquities and Greek times and stuff. And they were talking about balance back then, humoral balance, balance in the artwork and stuff like that. And it all goes back to, we said this here before, the Fibonacci sequence. Our brain is drawn to balance. Now, it doesn't mean that there aren't some things that aren't balanced that we are attracted to. I think there was one time we talked about like models, Amy. They all have big foreheads. A lot of them have big foreheads.
5 heads.
Like they're if for some reason to our eyes that looks good, right?
Well, because it looks different.
Or whatever.
Yeah.
But most of the time, our eyes are drawn to balance in structure, balance in form, balance in music, balance in anything that we ingest.
That's why I can't stand jazz.
Yeah.
Ooh, even just saying jazz makes me uncomfortable.
And I have to say, there is a little bit of tension in jazz that I enjoy because it makes me feel a little bit more alive, but it has to be played at the right time or I feel uncomfortable.
It makes me uncomfortable.
Whereas some people I just think they're just better than I am. Their constitution is better. They find it. I can't get into a flow state with jazz.
Neither can I. It makes me very anxious.
Yeah.
Yeah.
So interesting.
Yeah.
But balance is where it's at. But the patient's perception of balance is sometimes different than what you would perceive or I would perceive. And so that communication part, talking to a patient beforehand, understanding what their North Star is, understanding what their goals are, is super important. And that's where Amy's really, really, really talented when it comes to breast augmentation, where she hears what the person's saying, and she kind of nudges them in the right direction and gets them to that sweet spot, that Goldilocks area.
Yeah. This was a really good one. They said, yes, before my rhinoplasty and chin implant, I was so embarrassed of my profile. Any pics or seeing myself in mirrors felt like I was looking at a goblin. Now I feel normal, not beautiful, just myself, like how I was meant to look.
Wow, that's powerful.
Yes.
Yeah.
Like, I love that. And the next one was also a rhinoplasty. Said, there are things I'm not happy with, but the trade-off was more than worth it. 90% happy. And okay, so for someone, 90% may be all you get, but worth the trade-off.
Yeah, 90% is definitely good. I think a lot of patients would take that. You are paying a lot of money for these things. So I think if you were told beforehand 90% is what you're going to get and that's what you're paying for, yeah, that's fine. If it's 80%, 60%, as long as that's communicated beforehand.
Correct.
Yeah.
Yep. These next two go back to what I said about someone with the thoughts about like your body image after pregnancy. This one said, yes, all capital. I breastfed 4 children and it destroyed my boobs.
Yeah, totally.
I hated them. I got implants and a lift and I love my body now.
They all love it.
I feel much more feminine. And then this next one kind of says the same thing. Yes, 1000% feel more confident in and out of clothes and just in my skin in general. I do find myself having to keep it in check, though, to make sure I don't find myself going down the slippery slope of obsessing over what else I can fix.
Yeah, totally. So a lot of times when I don't really tell people what I do in general population, because then it always leads to dumb questions. But every now and then I'll get the question like, well, I mean, do they really need it? And it's always a dude, you know. Like, I don't understand. And I was like, well, if you breastfed 4 kids, your breasts are totally deflated, asymmetric, like deflated tube socks that hang down. Well,
even if you didn't breastfeed, some women's breasts just look like that.
Yeah, exactly. So, of course, if they want that, of course, they're 100% a candidate. It's not like, it's elective.
It's not like having an appendix that ruptured.
But and it's so funny how myopic people can be when they're not dealing with the same situation.
Yeah.
So if you said it differently, if the person fell upon this problem in their life, then they could maybe be more empathetic.
Sassy.
Yeah.
Throwback.
Yeah, exactly. But like if you fell upon something in your life, maybe something was more human related. You lost a job, you went bankrupt, something.
Or you were in a car accident and now you have a scar.
Yeah, and then they would be like, oh, I feel bad for that person. But for some reason, physical problems that people encounter with life, genetics, pregnancy, somehow is some weird esoteric thing. I just don't get that.
Well, but that's okay also. I mean, it's okay not to put emphasis on the way you look. That is fine also. Like, that is also okay.
If that's a woman who has deflated breasts from pregnancy and chooses not to do that, I will listen to her. But some random dude
well, no, I'm saying
that has never breastfed.
What I'm saying is it's okay for a man to look at a woman and not be obsessed with her looks.
Yeah, of course. Yeah.
I don't see that as a negative.
Yeah, maybe you're right. So to give consideration to that person, maybe the said person is looking at it through his eyes and saying she's fine the way she is.
Right. Like, I don't have a problem with this.
Right.
Why should she?
I understand that.
Yeah.
Okay. Yes.
Yeah. There's both
You're
sides.
being nice.
No, I'm just showing the other side, because both things can be true.
Check weird Reddit. People are into anything.
Oh, exactly. Yeah. You want to find someone who's into whatever weird you got, you'll find it on Reddit.
Preach.
This one is the last one in this category, and then we're going to take a break and come back with some of the shorter ones. But this one just said no, but I am not happy with my outcome and potentially suffering from body dysmorphia. And that's where we said, like, surgery, no amount of surgery will make you love yourself if you don't. Mm-hmm. It just won't.
And body dysmorphia,
real.
is a clinical diagnosis, it's a chemical imbalance, it's a medical condition. It's in the DSM-V, whatever we're on now.
Right. And surgery is not one of the fixes for it.
Yeah. So, for those types of people, I just have an immense amount of compassion for them. It's
like my dyslexia. Like, these things are real, even if they're only in your head.
Yeah.
Like, you can't help it that is the way you view something. When I see P4Y and it's PY4, and you see yourself one way and the world sees you as another, I mean, that's unfortunately, that's hard. So I really feel for that person. And that's more than anything, Nils and I were chatting before we started, just that this is what I've found really cool about Reddit. Like, look at all these different experiences of people, on one question. So, and there were hundreds. This was only a small selection under this question.
I feel like I could just keep on going with this.
Well, the next ones are really cool. So we're going to take a quick break and then we're going to come back with a few more isolated questions.
I'm going to go on weird Reddit during the break.
Oh my goodness, please don't. Do that from your own computer.
I'm going to do it on your phone. I'm going to mess up your algorithm.
My algorithm is going to have some weird stuff on it. And we're back. I don't know what to expect on my phone now after Dr. Martin searched on Reddit.
I guess you're going to have to see.
Yeah.
Don't look at the search history.
These next ones.
I should have done it incognito.
Well, that actually doesn't work. But these next ones were interesting. And this one, it only had one response, but it was the best question. So it said, how did plastic surgery change your life except improving your confidence? So they were looking for things outside of an improvement in confidence. Did surgery change your life in any way for better or worse? I got a nose job and I am much more confident in my appearance now, but otherwise I didn't notice a lot of difference in my life before my nose job.
I could have told you that.
Right. But did it change your life? Did you experience downsides of having plastic surgery? Or did you get better jobs? Or did your dating life improve? Just curious. Did you develop new insecurities? Such a great question.
Yeah, it's so good.
We talked a lot about this on our episode about rhinoplasty, which is linked. There was only one response, but it was also very good. They said better, not by a lot, because I already had a pretty good before my breast aug. It didn't impact my confidence, though. I noticed female friends / acquaintances acting different around me. So I've made a point not to show my cleavage when I see them or at group events. I'm a lot more aware of what I wear now and how my bust looks, especially in scenarios where I don't want them to be noticed, work, family events, etc. So interesting, right? So they didn't really improve their self-esteem because it was already really good and they're really happy with surgery, but they noticed how other people interacted with them a little bit, which is interesting. And I will tell you this, women are mean. So I'm not surprised. And a lot of that probably comes from jealousy, right? Having surgery that maybe your friends couldn't afford or really want makes them then kind of talk down about it because it's something they want.
Yeah, you talked about it in our best of. I think it was one of the clips. I don't know.
It was also in the rhinoplasty episode.
Yeah, you talked about surrounding yourself with your tribe, especially in the recovery phase. But I didn't think about it like past the recovery phase where you're normal or you're new normal and you still have to worry about it. That's definitely a little bit deep. That's unfortunate, though, that people would be judgmental.
Well, it is, though. And it was actually kind of interesting. So a patient of ours who had surgery about a week ago, she and I had a video like a week before her surgery. And she goes, so I've been patting my bra slowly over the last couple of months at work.
That's smart.
That's really smart.
So that there wouldn't be a noticeable difference. And I'm like, she's like, so people won't notice. I'm like, well, hey, you're putting a lot of stock in people to notice because she was getting a very conservative breast augmentation. However, I just thought it was so funny that she was like forward thinking, like, I'm just going to start stuffing just a little.
I mean, you could never say never and everyone's situation is different, but most people in work situations, no one's really looking at them.
It depends what you do for work.
Yeah. I mean,
either they're looking a lot or they're not looking at all.
Unless they're like in front of people, front facing, and it's like their big part of their job is the way they look. Most people are not getting looked at. Most people are going to work and they just want to get the job done to go home. So a lot of times your perception of what people are thinking or saying about you is different than what's really happening.
Well, I would say that's 100% of the time, most likely.
With that said, if that's what makes her feel comfortable and confident, I love it. I think that's a great approach.
Yeah.
Ease into it. Make sure that people don't have any different feelings. If that makes her feel better, great.
Yeah. If all it does is make you feel better about it, that's totally appropriate. Totally. Yeah. So I loved that question. The next question, this was a different thread. How were you impacted mentally after your surgery? Regrets? ? So there were only a couple, but they were all really good. This one said, no, I didn't lose a sense of self. I liked myself better and was more confident. I was realistic in my expectations and truly wanted an improvement.
Right.
You can strive for improvement, not perfection. Most surgeons said that, I love that they went to more than one surgeon. I like my side profile and my less tired looking eyes, and I know it looks good. It's just a small piece of mine that makes all the difference that no amount of therapy would have helped.
Right. That's
right.
I love it.
Well, and I loved that they said you can strive for improvement, not perfection. Yes. Yes. This one said, it's been a boon to my self-esteem. Results that are subtle but impactful will make you feel like the best version of yourself instead of someone else.
Mm-hmm.
Talk on that, because we say that to people.
Yeah. So
they'll say, like, I don't want to look like so-and-so.
Right. So the idea of plastic surgery, the way we do it, which is like, assumably, this is the way most plastic surgeons do it.
Assumably.
Nice. There's one.
Is this? Okay. Is that a real word? Or?
I don't know.
Assumably.
It's going in our dictionary.
Yes.
Okay, good.
It is going
the
up
Martin
there.
Medical Dictionary.
Volume S.
Yeah, assumably. Yes. Yeah, volume S. So the idea of plastic surgery is not to change the way you look. And that's a lot of the reasons why people come to us specifically, because that's my ethos. I've always been that way. I believe in a natural aesthetic, and it's really about making things better. As Amy talked about, perfection is not attainable for any reasons when it comes to appearances, because you can bring the best looking person in the world, like the most beautiful model, or someone you think of in your head, and you could bring them in my office. I could find something wrong with their body. We can find something wrong with everyone. But it's about
beauty is in the eye of the beholder.
Exactly. But it's about, for you as the person, as the viewer, as the one perceiving yourself, it's about finding those percentages that we can improve to make you feel not only better about yourself, but the better version of you through your eyes, not through other people. Now, every now and then I do surgeries that are related to people that are in the front-facing positions or whatever you want to say, that they're models or they're on TV or whatever. Yeah, there's elements there that are saying like, I noticed this on my pictures or something, but that's not normal. Most people have normal lives and they just want to feel and look a little bit better. And that better version of yourself always is someone that looks like you.
Right. The cautionary tale of Jennifer Grey.
Yes. If you really want to change yourself, which is totally fine, and people do that and they're happy with the results, you better be prepared for the consequences on that.
Yes.
Now, if someone, sorry to interrupt, but if someone loses 200 pounds and they have like skin that's hanging off and soft tissue that's hanging off, what?
You've been tapping a lot in this episode. Nils is going to have to get all those tappy taps out.
All
He
right.
can hear them. I know he can.
So if you're talking about an extreme situation like that, well, clearly you've already changed. So this is your newer version. And you're trying to clean that up. But those are extreme situations too.
Yes, those are extremes. This one I thought was really interesting. Again, we talked a lot about this in our rhinoplasty episode, that they are one of the surgeries that probably has the most kind of challenging mental side effects. That was definitely what happened to me after my nose job. I absolutely was not botched. My results were exactly what I expected. But I did get quite depressed about the fact that I had erased a part of the old me forever. I've learned to a certain extent now, but it was I've learned to accept it a certain extent now, but it was definitely tough. So the words she said, it was exactly what she was promised. She was not botched.
Yeah.
But she still felt like it had erased a part of her.
Mm-hmm.
So even when it's good, it doesn't necessarily mean that you're going to feel the way you might think you should feel.
Right. I mean,
and that's okay.
This happens all the time in life.
Yeah.
Think about, we work so hard to build up to certain, like a vacation or something in work, or get a degree in something, or run a marathon, or whatever that thing is in your life, and you do it and you're like, okay.
That's the hedonic treadmill.
Mm-hmm. Wow. Okay. So, and cosmetic surgery is no different. And then you're going to always think about what ifs. That's human nature. But the key on this is that the doctor or the surgeons told her exactly what he was going to do or she was going to do. And they did it. And the results were exactly as promised. That is honestly the best insurance policy for any elective procedure. We do that all the time. That's how you can guarantee you have very happy patients. And even when they're not, quote unquote, happy.
This person was not.
Right. Even when they're not, quote unquote, happy, they can wrap their heads around what they did. It was exactly what you discussed. They don't feel taken advantage of. They don't feel depressed that they made the wrong decisions, that they'll admit, hey, I made this decision. We've had a patient, one of the few patients, take out their implants. And she said, you did exactly what you said you were going to do. I lived with it for a little bit. I didn't like it. I just want them removed.
Yeah.
That was completely logical, actually.
Tons of people have those surgeries.
It was pragmatic.
Yeah. Yes. Yeah.
Assumably, she was very happy.
Assumably. This one was also about rhinoplasty, but in a little bit different way. Said, I had panic attacks after rhinoplasty, but it was because I did not like no breathing from my nose for 5 days, which we talked about in our rhinoplasty episode. I didn't regret the nose job itself, but I didn't know my tip would stay hard probably forever, but it's a trade-off. It won't stay hard forever, but it does feel hard for a while. We talked to our patient, it feels like wood.
Yeah.
Yep. Yeah. So I thought those were interesting. And then these next two, this one was actually the one that started it all. What is something you wish you knew before having plastic surgery? And there were only a couple of responses. Expect better, not perfect. That as soon as one important item was fixed, I would notice other quote unquote huge flaws in myself that I had honestly never noticed before.
Right.
Happens all the time.
Breast reduction, you reduce the breast and all of a sudden your belly's huge.
Right. Like, when did I get this gigantic stomach?
Yeah.
Or, oh my gosh, my thighs.
Yeah.
Change most likely won't be that dramatic and it occurs slowly, which is true, I think, especially in things like a facelift, because you still look like yourself. So people think that nothing changed because in their mind, and they're looking at themselves every day. And then you show them their before pictures and they're like, oh my gosh.
Yeah, that's usually when the tears start.
Yes, because you forget right away because you still do look like yourself. You look like yourself from 10 years ago, but to your mind, that's not different. Mm-hmm. So you start thinking that it's not different. I mean, you know how many times I've shown people their pictures and they're like, never show these to anyone because they forget. Mm-hmm. Like, and we all do. Like, we take what we...
It's a defense mechanism.
Yes.
That's the way our brains work.
Well, and our brain remembers. Like, yeah, you look like this.
It's also trying to compartmentalize and forget stuff.
That too. Yeah. Yes, like traumatic experiences. And then this one was a really long post. But the gist of it was, for anyone struggling with post-operative depression and self-love, celebrate your small wins. And they went on to talk about one of theirs was, there were, again, very few responses, which I found so sad, but this person really summed it up. They said, true. With every physical change and enhancement, I care less. No one cares about these changes, so all that matters is how I feel about myself, which is incidentally the only thing that people do really care about and what makes one attractive and unique. Their energy, their attention to the world, and their way of dealing with life. In short, no one gives a flying bleep that out, Nils. If your nose
Can I say it? Flying bleep that out too, Nils.
Right? Is 3 millimeters thinner, but they will appreciate your kindness and positivity.
Right. And your ethos and your energy and your empowerment and your pumped upness.
Yes. And we see that. Like I say, one of the best parts of my job is that we get to interact with so many unique people that, I'd never probably run across in normal life and or have the ability to communicate with them like we do. People are fascinating. And the ones that are the most fascinating are the ones who just have that thing that no amount of external anything could take from them or give to them. They have energy. They have, vivaciousness in life.
Joie de vivre. Yeah. That's what the French say. But there was a patient this week, a mom, really sweet, normal, nice, was nervous before surgery, came in and saw her. You were taking out the sutures and did a breast lift and augmentation on her. And just the smile on her face.
She's so happy.
So happy. And I was like, God, we have the best goddamn job. I mean, seriously, not many people get that experience.
That'd be the only place where you're taking sutures out of a person and they're smiling.
yeah, exactly.
Weird.
It's so weird.
Yeah.
I'm not gonna.
Hospital.
I'm not gonna. We have a weird job. Yeah. There's so many weird things, but just that feeling of positivity, you could feel it in the room. She was excited, and we get that over and over. And that is, even for us, is kind of infectious a little bit. So, I mean, sometimes I have to tamper down. Like they'll come back, what else can we do? I'm like, oh, that was so exciting. Let's do something else. But it can be really, really amazing for your life. Mm-hmm. But there is so many trade-offs. This is really just went back and forth. I love how you organize that. This
also, what she said, or she or he, what they said, no one cares about these changes. So all that matters is how I feel about myself. Mm-hmm. And that is true. And that was kind of what I was saying with like the comments about men saying they didn't understand why women would want to have plastic surgery. I mean, really just take any person. Let's take the gender out of it. No one cares about ourselves the way we care about ourselves.
Right.
Good and bad. We say the meanest things to ourselves. We say horrible things to ourselves. But other people don't. And this is where I always find it interesting. Like after surgery, people will be like, well, no one noticed. Like, well, what did you expect them to say?
Right.
Or do. But they feel like everyone noticed.
That's been a gift that plastic surgery gave me. There was a time in my life where I was kind of Pollyanna. I was like, if you do all these things and everyone, you reach these things and everyone will accept you and all that kind of stuff. And plastic surgery quickly makes you realize that no one cares what you're doing, what you look like, as long as you're in general a pretty good person, nice person, treat them well,
kindness and positivity,
flying
folks out the door,
right? But other than that, they may say, hey, it looks like you lost weight, hey, wow, that's great, you did this thing professionally. It's not like that. Now, dear friends, loved family members, significant others, that's different, but they love you unconditionally. It didn't matter if you had 3 noses and 4 breasts and 1 uneven leg and all that.
There's a weird Reddit stream.
Yeah. So the
quad breast.
It is truly in those kind of relationships, they don't care. Ultimately, they love you for you.
Well, neither does a stranger on the street, but we assume they do.
Right. So it is. Yeah, it's kind of weird, our job, but I have to tell you, over and over, I hold on to that feeling of seeing patients smile and happy. Mm-hmm. It really gets me up in the morning.
Oh, we get the best job.
Yeah. And I like when the day comes when we're going to retire, and I know that's a long way off, I already fear that. I like, what is that going to be replaced by? How do you replace that? Like you'd have to find some sort of philanthropy or something. I don't know. I mean, it's crazy. Like you think about so many people's lives we touch and we give them joy, and maybe it's short-lived. Maybe it's only related to a small little thing, but man, you can make a big difference in people's lives for sure. Mm-hmm. With full understanding that it doesn't really mean much anyways.
Exactly.
I feel like we're in a philosophy class.
I have said it before that no amount of facelift can make somebody stop frowning.
Yeah.
And there are people that are just kind of miserable people.
Yeah.
No amount of surgery is going to fix that. Like no amount of, we can make you look less tired and less angry, but that doesn't make you less angry.
No, I agree.
So I found these fascinating and so deep and so interesting. And I really feel good in a lot of ways that there are people out there that are having this dialogue. There are obviously strings that are completely different than these ones, or threads that are completely different. But I was very impressed with what the general population was willing to share and put out there.
Yeah.
Yeah.
Reddit comes through again.
Yeah. These were cool.
Let's go Reddit.
And they are reflective of what we've said in the past about surgery and self-perception and happiness and all those things.
That is better marketing than anything I've ever read from the industry.
Right?
Just these true experiences, especially that last one.
Yeah.
Where it's just like, it's about how I feel. And I'm wondering, like, when people have something done and they're around their loved ones and they're really stoked about how it's made them feel, I'm willing to bet a lot of the loved ones notice just their energy and their attitude. They might not know anything, that they might not notice the bigger breast or a little different nose or anything else, but they'll probably say something like, "You look good."
Yeah.
You know what I mean? Like, what's
It's total.
Did you get a haircut?
Yeah.
Something like that, where there's definitely an energy that comes out about it. Even if you just lose a little bit of weight, people will be like, "Did you grow a beard?"
Yeah.
And I'm like, I've had a beard for 20 years.
But they're trying to see the difference.
Yes, exactly.
You know?
They're noticing something about you that I think that you're carrying, and kind of, like your energy is kind of putting it out there for them to pick up on.
So most people don't know what changed.
Yeah.
So, but I have the type of mind that notices things that change. I mean, that's what I do for a living.
Yes.
So any like coworker, not like here, but like in the ORs or friends, I notice right away if their hair color changed, if they lost weight, if something's different. And I always point it out positively. And it drives my wife crazy. She's like, "You're getting into their business, Why are you like yelling in front of other people? Hey, you lost weight. You look amazing." And I do that because I have heard so many times from people like, I wish someone would say something. Yeah. So I'm the guy out there saying that, they all know what I do. So I think that comes with some sort of understanding that like I'm not some weird dude just coming along, "Hey, you lost weight, look great," that kind of thing. So, but recognition for those changes. What?
I think there's a double-edged sword there when you comment on somebody's weight, because not everybody loses weight and wants to.
Right.
Most people do. But that's
I'm not saying this to people that I don't have relationships with. If I'm not saying it's some random person I work with in the OR or people that I don't understand.
Okay.
It's for people that I have like actual relationships with and I know, like family members, close friends and stuff.
That makes more sense.
I would never say it like at the grocery store or something like that.
Well, or to a random scrub tech that you've never interacted with before. Like, wow, you were fat before.
No, never. Well, because number one, that's an HR problem.
Exactly. So, that's kind of more what I was getting at. Like, maybe don't comment on people's bodies. And
I'm sorry if I sold it like
you're
that.
Sometimes tuned into their lifestyle changes anyway. So it's sometimes just nice to say like
to reinforce their behaviors.
You're working hard.
Yeah.
You know what I mean?
But
whatever comes from
I do think if you are close with someone or, work wise or personal wise, and you have a relationship and you understand and say they've said to you, they've revealed to you they're losing weight or they're doing this, I think affirmation is really nice.
Positive reinforcement is good. Yeah. Yeah.
Okay.
Well, celebrate your small wins, I think we're going to end with that one because I loved it. So please celebrate your small wins. After surgery, it is challenging. Recovery is not easy. I had a patient recently tell me that they had no idea that recovery was a full-time job. I'm like, well, you had a facelift, a tummy tuck, a lot of lipo. Like, you had more surgery than average, or not more than for us average, but more than like someone who had an ACL repair. Like, yes, like recovery will be a full-time job for about 6 weeks. And that really gets in your head. There were a lot of threads on Reddit where people were asking for tips, like how to help someone else through their recovery from plastic surgery, which I thought was really cool. Like, how do I help my wife? Like, what should I have on hand? Like, great things to think about, because as you saw from this, your emotions will probably run the gamut.
Oh, yeah.
Whether your results are good or bad, your results are not really dependent on your perception of your outcome. And it's a little bit of a roller coaster. Yeah, but celebrate your small wins. All right. So if you've made it this far, we appreciate you being here. We appreciate all these Reddit people as well. Be sure to follow us if you haven't. Here are all of our social media handles. We are everywhere at Beauty and the Surgeon Podcast and at Jason Martin, MD. We also have a voicemail phone number. You can leave us a voicemail, 303-630-9038. What did I call that before? A voice message? I called it something that was a combination of voicemail
Video message or something like that. It was Jetsonian.
I made up a word. So yes, send me a text. I can't remember either, but it was good. It was a good one. It was a benefer. It was a benefer. All right. Well, we do appreciate you all so much for being here, and we'll see you here next time.
See you later.